Meanwhile, there are growing calls to shut down subscription fees to access health care providers.
Clinics charging hundreds of dollars for someone to see a nurse practitioner. CTV's Queen's Park Bureau Chief Siobhan Morris is live with more on this. Siobhan.
Well, the promise is for fast, compassionate care if you're willing to pay. Critics at Queen's Park want the government to make good on its promise that Ontarians won't have to pull out their credit card for health care. It looks like any other medical office, but at this location near Toronto's downtown core and at a second a few kilometers north, a medical checkup will cost you. They're selling annual memberships for as much as $1,200 a year.
OHIP-funded services must be covered by OHIP, cannot be charged.
But these clinics appear to be operating in a gap in the rules based on who's tending to patients.
OHIP is for physicians, it's not for nurse practitioners.
The issue bubbled up last week with the opening of a clinic in Ottawa using nurse practitioners. They're charging a $400 annual subscription.
We opened an investigation, started asking questions last Thursday when we heard about this, and we will shut down that practice if it is occurring.
The clinic says there are 10,000 people on its wait list. When 2 million Ontarians don't have a family doctor,
there is, I literally say, desperation out there for families to want to get access to care. And so they're willing to do that. It shouldn't have to be that way.
The NDP leader says the loophole needs to be closed.
As long as it exists, greedy healthcare corporations are going to continue to exploit it to make big bucks off of people's health.
The head of the Registered Nurses Association of Ontario says subscription fees, paying for visits, won't stop.
Unless the government decides to put all nurse practitioners as publicly salaried.
Not just those working in the 24 nurse practitioner-led clinics open before the Ford government took office.
If there are gaps in the services that people are being charged, then we will look at that and we will close those loopholes.
Though not a promise to fund the nurses themselves. The Registered Nurses Association says nurse practitioners could be helping far more people across Ontario if the government were to fund applications for clinics that are on the books already in many Ontario cities. Reporting live from Queen's Park, I'm Siobhan Morris.